name is Kelly Lyons, and I will be discussing smoking cessation and a potential study I developed to help determine which stop smoking medications are most effective over a 6-month period. Smoking is a global issue. It is the #1 cause of preventable disease and death worldwide. In America alone, about 1 in 5 people die each year due to the effects of smoking. Kentucky has one of the highest rates of smokers. We rank 49th out of all 50 states for smoking. About 28% of Kentuckians are smokers. For my study, I'm focusing on the rural community of Montgomery County. The smoking rate in this county is 31%. We all know smoking has negative health effects, but once you get hooked, it's hard to stop. Nicotine found in cigarettes is physically addictive, and more people in the United States are addicted to nicotine than any other drug. Aside from the physical addiction, people often associate smoking with social behaviors too. This means people who are trying to stop smoking will also benefit from counseling and behavioral changes. The CDC claims that almost 70% of smokers actually want to stop smoking. There are several medications that are designed to help people stop smoking. Some are over-the-counter, like nicotine gum and lozenges, and others require a prescription, like nicotine patches and varenicline, which is also known as Chantix. There have been several studies to compare the effectiveness of nicotine patches and varenicline with varying designs and results, so I decided to design my own. My single-blind randomized controlled trial will take place at the local health department and will include participants within Montgomery County who are trying to stop smoking. I plan to recruit participants from the community with flyers and newspaper ads. During the first visit, I will record baseline health data, cigarette dependence, and a non-invasive exhaled carbon monoxide measurement. Researchers will equally divide participants into 2 groups. One will be given varenicline and a placebo nicotine patch, and the other will be given a placebo varenicline and an active nicotine patch. The participants will not be aware of which their active medication is. Participants will take their assigned medications for 4 weeks. They will be followed up at week 2 and week 4, and week 4 should be their target quit date. And then again at 3 months and 6 months after stopping their medication. At every follow-up, I will ask them about cravings and withdrawal symptoms and any adverse effects they may have experienced. Exhaled carbon monoxide measurements will also be taken, except for during week 4, which, as you can see from the timeline, could potentially be a telephone follow-up. A result of less than 10 parts per million of exhaled carbon monoxide would be used to confirm smoking abstinence. Based upon previous study results, I expect the active varenicline group to have better cessation rates. Each participant scenario is different. Some may require a combination of therapies, which has been shown to have an increased risk of adverse effects, but it's also been effective for smoking cessation. Because of the huge healthcare burden of smoking, it is important for practitioners to be up to date on the best resources to give their patients. The National Quit Line, which is shown here, is also available free of charge to everyone.